You're paying for benefits every single month, and chances are you've never used them. Not because you don't qualify, not because they don't exist, but because no one ever told you they were there. Right now, buried inside your health insurance plan are free services that most Americans assume cost extra. Doctor visits that cost $0. Mental health support people pay hundreds for out-of-pocket. Wellness programs that literally pay you to stay healthy. And here's the uncomfortable truth. Insurance companies don't lose money when you use fewer benefits. They lose money when you use all of them, so they don't advertise these perks. They don't highlight them during open enrollment. And they definitely don't remind you mid-year that you already paid for them. Which means millions of Americans are overpaying not because insurance is bad, but because they're only using a fraction of what they already own. And if you've ever felt like health insurance is expensive, confusing, or never works in your favor, this video might completely change how you see it. Most people think health insurance only matters when something goes wrong. You get sick, you get injured, you go to the doctor, and until then, you're just paying a monthly bill and hoping you don't need it. But that belief is exactly why insurance feels like a bad deal. Because health insurance isn't just a safety net for emergencies. It's a toolkit. And most Americans only use one tool out of the entire box. Here's what nobody explains clearly. Modern insurance plans, especially employer plans and ACA Marketplace plans, are packed with built-in benefits designed to reduce your costs, prevent expensive problems, and keep you out of high-priced care. Preventive services that don't touch your deductible. Telehealth visits that cost less than a cup of coffee or nothing at all. Mental health support that's already subsidized. Prescription savings that depend entirely on how you fill your meds. Wellness perks that reward healthy behavior with real money. Yet, year after year, people skip them. They delay care. They pay out of pocket for services already covered. They assume free means low quality, and they never check what their plan actually includes. Insurance companies rely on this behavior. Because the system ICE&T built to educate you, it's built to assume you want to look. And that's how two people with the same insurance plan can have completely different healthcare costs, even though they receive the same level of care. In this video, we're pulling back the curtain. We're breaking down the hidden benefits in most insurance plans that people rarely use but absolutely should. No fine print, no jargon, no confusing charts. Just clear, practical explanations you can use immediately, whether you're on an employer plan, buying insurance yourself, or covering an entire family. By the end of this video, you'll know which benefits you already have, how to start using them today, and how to stop leaving money on care on the table. Because once you understand what your insurance actually includes, it stops feeling expensive. It starts working for you. Let's get into it. Absolutely. Below is the full long-form script with 7 highly engaging parts, approximately 400 words each, followed by a strong closing plus CTA, written for a faceless YouTube channel, optimized for retention, clarity, and US audiences. Let us start with the biggest hidden benefit in almost every health insurance plan: preventive care that costs you nothing. No deductible, no copay, no out-of-pocket cost. Annual physicals, blood pressure checks, cholesterol screenings, diabetes tests, cancer screenings, vaccines. These services are fully covered by most insurance plans under US law, and yet millions of Americans skip them every year. Why? Because free doesn't feel urgent. Most people assume, I feel fine, so why bother? But insurance companies know something most people don't. Preventive care is cheaper than treatment. That's why they cover it at 100%. Here's what most people miss. Preventive services do not count toward your deductible. That means you're not using up benefits, you're accessing them separately. Skipping preventive care often leads to diagnoses that happen later than they should. Conditions that become more expensive to treat. Faster trips toward deductibles and out-of-pocket maximums. In other words, Avoiding free care today often creates massive bills later. Another reason people miss out. Confusion. Many people don't realize labs, screenings, and tests must be coded as preventive to be free. If you wait until symptoms appear, those same services may suddenly cost hundreds. Timing matters. Preventive care is not about reacting, it's about staying ahead. And here's the irony. People complain insurance never covers anything, while ignoring the one category it covers completely. Using preventive benefits keeps you healthier, keeps costs predictable, reduces future claims, protects your finances. Insurance companies rarely remind you of this. But now you know. And this is just the beginning. Imagine needing a doctor at 9 p.m. Most people assume they have two options: urgent care or the ER. Both are expensive. Both take time. Both trigger bigger claims. But here's what most insurance plans already include: telehealth visits for little to no cost. Virtual doctor visits often cost $0, $10, $20 at most. That's cheaper than parking at an urgent care clinic. Telehealth covers minor illnesses, prescription refills, skin conditions, infections, mental health check-ins, follow-up questions, and many plans offer 24/7 access, meaning you don't wait days or weeks to be seen. So why don't people use it? Because it's not promoted. Insurance companies include telehealth because it saves them money. Virtual visits reduce QA visits, reduce claims, and reduce expensive follow-ups. But if you don't know it exists, you default to higher cost care. That's exactly what happens. Another hidden benefit. Telehealth visits often don't apply to your deductible, meaning you can get care without triggering bigger expenses later. Parents, in particular, leave massive value unused here. Pediatric telehealth can prevent unnecessary urgent care visits that cost hundreds. Telehealth isn't lower quality, it's efficient care. And in many cases, it's the smartest financial move you can make with your insurance. If you've ever gone to urgent care for something minor, your insurance plan already had a cheaper option. Here's a painful reality. Millions of Americans pay hundreds per month for therapy, while already having mental health coverage. Mental health is now considered essential care under most plans. That means therapy, counseling, and psychiatric services are included, not optional add-ons. So why do people pay cash? Because insurance makes mental health benefits confusing on purpose. Copays often look intimidating. Networks feel hard to navigate, and many people assume coverage is limited. But here's the truth. Many plans heavily subsidize therapy, especially virtual mental health services. That means lower copays, lower session costs, access to licensed providers, often no deductible required. Some employer plans also include employee assistance programs, IEPs, which offer free therapy sessions, financial counseling, stress management, legal support, and most employees don't even know they exist. Mental health care doesn't reduce coverage, it strengthens it. It prevents burnout, reduces chronic illness risk, and keeps people productive. Insurance companies don't advertise this because unused benefits are profitable. But therapy paid through insurance is often hundreds cheaper per month than cash pricing. If you're paying out of pocket for mental health care right now, there's a strong chance you're double paying. What if your insurance plan paid you for being healthy? Because many of them do. Wellness programs are one of the most underused and least advertised insurance benefits. These include gym reimbursements, weight loss programs, smoking cessation support, nutrition counseling, health coaching gift cards, or premium credits. Some plans offer $300, $1,000 per year in incentives. Why don't people use them? Because wellness doesn't feel urgent, and insurance companies don't push it. But here's why these programs exist. Prevention lowers claims. Insurance companies would rather spend a few $100s helping you stay healthy than thousands treating preventable conditions. Many plans quietly reimburse. Gym memberships, fitness apps, wearables, lifestyle programs, others reduce premiums or deductibles when you complete health assessments. These benefits are already included in what you pay. Ignoring them is like throwing away part of your premium. Using them doesn't reduce coverage, it maximizes value. Prescription drugs are one of the biggest areas of hidden overspending. Same medication, same dosage. Wildly different prices. Insurance formularies are complex on purpose. But here's what most people don't realize. Sometimes, not using insurance is cheaper. Generic medications can cost less with cash pricing than with copays. Mail-order pharmacies often offer 90-day supplies at a discount. Different pharmacies charge different prices for the same drug. Many plans encourage mail-order prescriptions, but don't explain the savings clearly. Others cover generics at extremely low costs, but patients never ask. Prescription optimization alone can save hundreds, sometimes thousands per year without changing coverage at all. Insurance companies don't automatically do this for you. You have to ask. Families leave the most money on the table. Why? Because parenting is overwhelming, insurance details fall to the bottom of the list. But family plans often include free pediatric preventive care, developmental screenings, lactation support, breast pumps, parenting classes, child wellness resources. Many new parents pay hundreds for breast pumps that are fully covered. Others miss early screenings that prevent costly interventions later. Insurance companies include these benefits because early care reduces long-term costs. But they don't remind you. Parents assume basic care means minimal support. In reality, family plans are some of the most benefited policies available. Here's something most people never realize. Your insurance plan includes people whose job is to help you navigate care. Nurse hotlines, care coordinators, case managers. These services help you find lower-cost care, prevent unnecessary ER visits. Coordinate specialists explain confusing bills, and they're free. Most people only interact with insurance when there's a problem, and by then, it's expensive. Using support services early prevents those problems entirely. Insurance companies include them because informed patients cost less. But if you never call, they never engage. Here's the truth. Health insurance doesn't feel expensive because it's useless. It feels expensive because most people don't know how to use it. You don't need better coverage. You don't need riskier plans. You don't need to pay more. You just need to stop leaving value on the table. The benefits we covered today already belong to you. You've already paid for them. Once you start using insurance intentionally, it stops being confusing and starts working in your favor. If this video helped you see health insurance differently, subscribe for clear, no-fluff breakdowns. Like this video so more people stop overpaying. Comment below if you have any questions. I read and reply to every single one. Your health matters. Your money matters. And now you're in control. Perfect. Here's a fully optimized, high-conversion YouTube packaging set for your video hidden benefits in most insurance plans you're probably not using. Built for CTR, retention, and search visibility in the US.